Welcome back to the Now Morning Show. Of course, one of the things that is so important all day, every day is taking care of your health. And joining us this morning to talk about the Arima Health Fair taking place on Sunday, the 27th of August at Calvary Hill Community Centre is Dr. Gill and Dr. Vimal. Good morning to both of you and welcome to the show.
Good morning. Thank you.
It's a pleasure to have both of you with us this morning, and thanks so much for getting up early, although I feel like you're probably used to this by now. Yes? All right. So let's talk a little bit about the health fair that's taking place now. I see here, Dr. Vimal, you are head of the urology clinic.
Yeah.
Is this something that's going to be focused on at the fair?
We will be seeing at least a few hundred men for assessment of their prostate health with checking and screening for prostate cancer. And we will also be offering PSA blood testing for them. And if you would really like the finger testing, you can have it done, but we don't have that as a strict policy. You can get your blood test done. It's at least screening for your prostate cancer.
That's so important, and thank you for mentioning that, because as we were talking about on air, when you hear that, or men I should say in particular, all of a sudden everything just goes awry, nobody's going to the doctor, everybody's fine, they've never been healthier. Dr. Gill, tell us a little bit about the health fair and what you're also going to be focusing on.
Okay, so the health fair is going to be on Sunday, this Sunday, the 27th of August. It's going to be in Arima, so the residents in Arima, we're coming to you. It's going to be between the hours of 9 a.m. to 3 p.m. And the venue would be the Calvary Hill Community Centre. That's in Arima.
So what is going to be focused on at this health fair? I mean, normally, you know, there'll be testing, as you mentioned, there's going to be blood testing focused with men in particular. Is there any key focus on women?
Yes, we would have pap smears for the women, of course. I mean, apart from the testing, the high blood pressure testing, blood sugar testing, cholesterol, women could expect to have their, pap smears done, and their mammograms done.
Wonderful. And this is open to all ages?
Yes, open to all ages and all groups. You don't have to be part of the Seventh-day Adventist Church, which has really helped us with this and has been the largest part and the largest organization driving us. But now we're up to about 20 organizations helping us along.
That's absolutely fantastic.
Yeah.
So we're definitely seeing that community coming together to support, ironically, the community in this initiative. Now, I'm assuming, of course, this is not your first rodeo, either of you, when it comes to health fairs.
No.
How well are these normally attended, would you say? Let's start with you, Dr. Gill.
Yeah, they are well attended. Residents come out, they're able to, be part of the screenings that we're offering. They appreciate it, and they spread the word. So it's actually well attended.
And that's very important. And what about you, Dr. Vimal?
So Caribbean men don't like to test for prostate cancer, as we all know. Right. But we've seen, at least post-COVID, we did one in Maloney about 3 months ago.
Right.
And we had a couple hundred men literally coming to us saying, look, I'm ready to be tested. And I think it did change things, that lack of healthcare or lack of being able to access the healthcare during that time easily. And now they've come and they want to be assessed and they want to be tested now and they want to be treated afterwards. So it's growing.
That's wonderful to hear, because it has definitely been a concern over the years. You see a lot of hesitancy, as we've just been discussing, of course, since we started this conversation. Now, Dr. Gill, if you could recommend to women what to get tested for when they come, what would you recommend?
Well, I can recommend, of course, the pap smear for cervical cancer, the screening tests that we do, breast examinations, for breast cancer. And there are other chronic, non-communicable diseases like high blood pressure, diabetes, cholesterol. We also offer the lung capacity testing, HIV, VDRL.
I'm going to stop you for a second. What's VDRL?
Oh, that's syphilis.
Okay.
Tests for syphilis. Yes. If you're feeling a little tight and tense, we're giving massages. So there are a lot of services that are being offered, and all are free.
This is sounding like an all-inclusive event. Massages are also available.
It is.
What else is available at this event?
Oh, what else is available? We have a cardiologist. He's going to be there. We have hearing screening, eye testing, dental services. We also have persons who have at risk for strokes. We can assess their risk as well. So there's so much in store for residents at Arima.
So we have eye testing.
Hearing screening, dental work,
massages.
Even persons with diabetes. We're going to, give diabetes awareness and education.
Okay.
We're going to have screening for diabetic feet, varicose vein screening. So yes, the list can go on
This
and
goes
on.
on and on and on. Now,
Yes.
interesting that you mentioned education in particular, but I'd like to come back to that in a moment because, Dr. Vimal, something that you mentioned was the Seventh-day Adventist Church is involved, and there are other stakeholders involved as well. Can you share who's involved?
Quite a lot, actually. So without wanting to leave out anyone, it's the Seventh-day Adventist Church, it's the Queen's Park Counseling Center, it's NCRHA, NWRHA, it's Caribbean Vascular and Vein Clinic, it's Needs Best Herbal, Alexandra Dental Clinic, Sweet Dental Clinic, Tech EMS Training, Caribbean Health Foods, Chest and Heart Association, and the Child Protection Unit.
Wow.
Just to name a few, because a lot of people do come out and help us. Yeah.
That's absolutely incredible. I have to say, this sort of feels like a one-stop shop. You know, everybody will go to their GP maybe once or twice a year just to do that checkup. This is beginning to sound like this could be the once or twice a year. Is that something you recommend or no, Dr. Gill?
Well, I recommend your routine checks. Of course, we want to see you there, but don't just stop there. When you come to us, when we assess you, we would further advise you as to when next you can get your health checked.
Okay, wonderful. What time does it start?
It starts at 9 a.m., Sunday the 27th of August, and we go through the day until 3 p.m.
And this is at the Calvary Hill Community
Yes.
Centre, correct?
Correct.
Now, you mentioned that other regional health authorities are also involved.
Yeah.
So are we also going to see more doctors there who are going to be helping out?
Of course. In the list of services that we're offering, we also have doctor consultation. So if you have a complaint, if you have a problem, you can talk to a doctor.
And
You
there's
can
no
see a
cost
doctor.
attached to this?
No cost attached.
That's something,
It's
of
all
course,
free.
that is critical because, you know, on many people's minds is the cost of healthcare as well. Now, you mentioned education. Are we going to see other areas of health being discussed with those who are at the fair?
Of course. So with each service that's being offered, some counsel, some advice would be given. So for instance, for persons who have diabetes, we would counsel them about fit care, you know, how to take their blood sugars, their medications, how compliant they are. We'd ask questions, we'd have a rapport. Same with those with high blood pressure, you know, we'd have an idea as to how controlled they are and then give advice as to how they can better manage their condition.
Wonderful. Now, you mentioned, of course, I'm assuming rather that there are going to be mobile units on site. Is that correct?
Yeah.
And there'll be mobile units for men as well.
So
Yeah.
with men, it's a little bit difficult.
Okay.
There will be mobile units and assessment, but if you do need to be assessed properly, I would bring you to the Arima clinic or to any clinic in your catchment area for where you live and write a letter to them. For this being at Arima, I would be able to help men get through to a clinic a little bit faster,
Right.
so that they can be fully assessed.
Okay, wonderful. So this really is it is a wonderful initiative.
Yes.
Is this I would say the beginning of health fairs in Arima of this caliber? Because I know we've had health fairs before, but not necessarily, honestly, on such a broad scale, at least from my memory.
So this has been the fourth for the year
Yeah.
in the Arima area. We did Malabar, we did Kelly Village, and we did Maloney, and now this is Calvary Hill. And the Seventh-day Adventist Church does one every single month in some part of the country. And to be honest, they're going to continue every single month. It's just about the last Sunday of every month.
The last Sunday of every month.
Somewhere across the country, yeah.
Okay, that's wonderful because, of course, we're seeing that investment in our health, which is so important. So I guess for those of you who are watching, make sure that you bring out the entire family. What about those who are not from Arima and say, hey, I want to go?
They're happy to come.
And there
We
you
want
go.
you to come.
You are more than welcome. Dr. Gill, Dr. Vimal, thank you so much for being with us this morning. And thank you so much for your service to our community. It's very important because you keep us all going.
Yeah, thank you.
Trinidad and Tobago Arima family and those from environs, make sure that you go on down or go on up rather to Calvary Hill Community Centre so that you can get your entire family and all of your health checked. There's more coming up on the Now Morning Show. Guess what? We might just be taking your calls and chatting with you a little bit more. We'll be back in a moment.
I never see people with them